Hi, my name is Dr. G. Balamurali. I'm a consultant spine and neurosurgeon in Chennai. I'm also a premium brand ambassador for Kotak Life, and I chose this role to understand better about two very important insurances which I deal with all the time related to my work. One is health insurance, and the second is life insurance. As a doctor, I see patients with spine and brain problems all the time. I see three categories of patients. One is patients who come to hospital with an acute problem or accident or a disease, and they end up having to stay in hospital for several days to weeks, in ICU, have surgery. They end up with a big bill. They're not able to afford this, and they abandon care and they go to a smaller hospital which does not have the adequate facilities. The second group of patients I see is they have a very small insurance, and they're not able to afford the care for some time, and they think that that was adequate, but it wasn't because the disease was so bad. The third category is younger people who are very ignorant and do not take insurance because they think they're fit enough, but these are the people who are developing more problems these days, like accidents, heart attacks, strokes, and various other problems. So the situation is very grave. If you look at the healthcare cost, every year the healthcare cost is going up by 15%. It is going to become threefold in many years to come. Quality healthcare is expensive. So if you want to have quality healthcare, you really do need to spend money. When you have an illness or when you have a disease, there are two types of stress that we go through. Number one is a physical stress, the stress of being in hospital and dealing with the problem and pain and suffering. The second is a financial stress. So I'm going to talk to you about health insurance and why it's very important so you can get rid of the financial stress when it happens. I want to tell you a real story about a patient who I dealt with very recently. He was a 26-year-old man from a middle income family who was in the IT profession, struggled hard to come up in life, well settled, had a car and a house, had a young wife and a 1-year-old child. Family was all sailing fine until suddenly he was involved in an accident. He was rushed to hospital. He was under my care. We had to operate him. He was in ICU and coma for several days. Days became weeks. And then at one point, the family came up to me and said that, "Doctor, we have exhausted all our funds. So we do not have any more money to spend." I had nothing I could do. The hospital subsidized his cost. We tried to help them in many ways, but he was going to be in hospital for longer than we thought. So at that point, the family had no choice but to take him away from the hospital. In these circumstances, the first thing they do is they borrow money, they sell jewelry, they sell property, they beg friends, the family abandons them, friends abandon them because they know that this man is not going to be productive and nobody is willing to give money. And this is a situation that we doctors face all the time, and we see this to very young people. Eventually, this young man was moved out of hospital to a smaller setup. He developed an infection. They had to spend more money, and eventually he died. Let me give you some statistics. India is the #1 capital for many things, but also for diabetes, hypertension, heart attacks, accidents. So we Indians are prone to many environmental, non-communicable diseases. Our environment is not very clean, and so we do not know when we are going to have a medical illness. You need to ask your agent a lot of questions about what is the coverage, what is the payout from your pocket, how much does it cover, what are the exclusions, what is co-payment, what is no claims bonus, whether it covers medication, lab investigations, inpatient cover, outpatient cover. So all of these information you really need to understand before you take an insurance policy. And the best insurance policy is when you have a good payout, when there is a high pay. Taking an insurance policy with a very small pay, especially when you're above 40, is not advisable. Don't postpone. Get your health insurance no matter where you get from. Identify the right one and take a health insurance policy and stay healthy. Thank you.